friends. Welcome to the daily update from the Aspen Daily News. My name is Oliver Sharp. Vaccinations continue apace here in the Roaring Fork Valley. Here to tell us more about the program is Dr. Kim Levin, Pitkin County Medical Officer. Kim, how are you today?
I'm great. Thank you so much, Oliver, for having me.
Thanks for being here. Tell us, where are we right now in the vaccination process in the Roaring Fork Valley?
We're doing really well here. We have given over 8,000 vaccinations, and every supply that we get every week from the state, we give that week. We don't keep any vaccinations. We don't hold them. They're getting arms that week. So we're doing a really great job here. There's an amazing collaboration with the IMT and with the hospital and with community health services and public health that we've created this mass vaccination clinic, as everybody knows, over at the Music Tent, and that's our main site where we've been giving vaccinations.
8,000 is such a huge number, especially in relation to the population here in the Valley. So just such positive news to hear that. Some recent other news, the Johnson & Johnson vaccine was recently approved, and I know we got some of those here. How does that change the landscape for vaccinations going forward?
Yeah, it's so exciting that Johnson & Johnson was just a week ago. It was approved by the FDA and the CDC, and we got our supply this week. We got 1,500 here at Pitkin County, and on Sunday was our first Johnson & Johnson vaccination day, and they were all put in arms that day, and it was a huge success. So as a third vaccine in our arsenal of vaccinations, it's really exciting, and really any vaccine that you're offered is the best vaccine as we kind of race against the variants here and try to get as many people vaccinated locally.
Right. Can you talk a little bit about the differences between the J&J vaccine and then the Moderna and the Pfizer? Are there any other benefits, or should, as you say, just get whatever you can as soon as you can?
Yeah, I mean, I think the message is they're all highly effective and safe. And the Johnson & Johnson vaccine, as many of you know, is a single shot, which is really nice for a lot of people, especially people who are working and logistically difficult to come back for a second shot. It's a single shot. It is, I do want to remind you that it does take at least 28, 29 days to create antibodies. And so you do have to wait for the effectiveness of the vaccine for all three vaccines to set in. The Moderna and Pfizer, which are the double shots, you wait 2 weeks after the second shot for full effectiveness of the vaccine. But again, we're so excited to have a third vaccine. There are some conversations that the Johnson & Johnson vaccine may not be quite as effective with the numbers that you're seeing floating around. However, it is just as highly effective against moderate and severe disease and against death. And so the endpoint for vaccinations is to save lives, and all three of them are equally as effective for that.
And such good news, as we mentioned, just getting vaccinations into people's arms. But we're not really through this pandemic quite yet. What do people still need to do even after they get vaccinated? What are we asking members of the community to do to keep everyone else safe?
Yeah, I mean, we really don't know. There's still a lot of data and information coming out. We know that vaccines create antibodies. We don't know for how long they stay around. So we are really asking everybody to continue wearing masks, wearing well-fitted masks, social distancing, and continue the 5 commitments, as we've discussed before, until more information rolls out about vaccines. But it's the safest thing at the hospital. We've had a very high vaccination rate, and we continue to do all of these protocols at the hospital and asking everybody to do the same.
And let's let people know how they should be getting registered and make sure they're on the list. A lot of people now getting into the phases that are available, which is just such great news. But how should people go about getting registered and make sure they're in line to get their vaccination?
And that's a really important question. So everybody who wants a vaccine and is considering a vaccine should register on the Pitkin County website, the Pitkin County COVID recovery website. There is a link in the vaccinations, and there's also a great new vaccination page that gives you all the updates about how many have been given, more data on vaccinations on that website. But there's a link to registering, and I really urge everybody to register your name when your phase comes up. All these phases are defined by the state in terms of who is getting priority, and we're really trying to put priority to the people who are most vulnerable. And we're now currently in phase 1B3, and that can be seen on the website too, to see where you come in line. And you will be contacted if you register and put your information in there. You'll be registered when your phase is up and be called in for a vaccine.
Excellent. Well, Dr. Levin, thank you for being here and sharing all of this positive news. So nice that people are finally getting vaccinated. It just psychologically feels very good. So thanks to you and the entire team at Aspen Valley Hospital and the Pitkin County Incident Management team. Really appreciate the efforts. And Vaccination Center is a well-oiled machine. We're so lucky to have all of you helping us out here.
It is. Thank you so much, Oliver. Appreciate your time.
Thanks all of you for joining us on this daily update. You can find us at theaspendailynews.com and across social media networks. We'll see you tomorrow.